Good afternoon, everyone. Welcome to our TCM 101 webinar. Let's start with blood. The concept of blood in Chinese medicine is not similar to its concept in Western medicine. It is, as we all know, it's the red liquid circulating in the vessels with the qi. Blood has the ability to nourish the body and our shen, the mind or the spirit. And it is inseparable from qi. So blood is actually a form of qi, a dense and material one. Qi infuses life into blood. Without qi, blood would be inert. And we derive blood mostly from the food qi or ku qi, which is produced by the spleen. And after that, the spleen would push the food qi upwards to the lung. And the pushing action of the lung is sent to the heart, where where the food qi is transformed into blood. Blood nourishes and moistens the body, which actually complements the nourishing action of the qi. So we could say that both blood and qi would have a nourishing action. So the blood provides the material foundation for shen. And this is very, very important, especially when you deal with insomnia, when you deal with the shen. Blood is part of yin, and we need blood to house and anchor the shen. So without blood, the shen would be restless because there's nothing that could anchor it. Let's talk about the creation of blood. So before we were born, while we were still in the womb of our mom, we have the pre-heaven source of blood. So as you can see, kidneys play a very, very important role because it's supposed to produce the marrow and particularly the yuan qi. So the yuan qi or the original qi, which is in the kidneys, will actually act on the marrow to produce blood. So after we are born, it's called the post-heaven source of blood. So foods and liquids in the stomach and spleen. Okay, spleen will convert or transform the food and liquids into food qi, the ku qi. Then it will transport the ku qi to the lungs, and it will have and this one will be pushed by the lungs to the heart, so that the ku qi will be transformed into blood. Let's talk about the functions of blood. First, it nourishes the body. Blood is circulated by the heart. In TCM, the heart governs blood. It circulates around the body that carries the nourishment to all the organs, muscles, tendons, and tissues. And it needs the assistance of the qi to help the blood do this. Second function of blood is it moistens the body. Liver blood moistens the eyes and sinews, skin, and the hair. So if you see someone with dry eyes or having issues with the sinews, at the same time having dry skin, hair, we look at a liver blood issue. Heart blood moistens the tongue and nourishes the shen. So if we have heart blood deficiency, we expect the tongue to be dry and the shen to be not having a residence, not having a home. So the shen becomes restless. And this is the reason why people with heart blood deficiency would find it very difficult to sleep. It would take hours before they get to sleep. Another function of the blood is that it houses the mind. So we have made mention of this earlier. it helps anchor the mind, helping us to have clear thought. So for people who do not have clear thought, we would always be looking at some blood issues. So when you are blood deficient, you will have anxiety and unclear or clouded thinking. Let's talk about blood deficiency. This is due to not enough qi to move the blood. Because in Chinese medicine, blood and qi, they're inseparable. Qi is important to move the blood, and blood is important to nourish the qi. So if you have blood deficiency, this is due probably to the fact that not enough qi can move the blood, or blood is not being produced. And this has something to do with the spleen's inability to move the good qi for blood production. Excess bleeding can also lead to blood deficiency, obviously. What are the clinical manifestations of blood deficiency? Pale complexion, pallor, pale lips, and pale, thin, and dry tongue. Patient will have insomnia, finds it too difficult to get to bed, to get to sleep, dizziness, vertigo, blurring of vision, palpitations, numbness of the hands and feet, fatigue, and pale face. So practically affecting the whole body. The tongue is pale with a very thin coating, and the pulse is thin. Let's talk about blood stasis. If qi is weak or stagnant, then it fails to move the blood. And this will lead to a condition known as blood stasis. And if you have blood stasis, this can develop tumors, or it may also be caused by trauma. So it is very important. Having tumors can be quite depressing. So we should be looking at not being predisposed to having tumors. So we should be always looking at blood flow. No? So we have to keep our blood flowing so that we won't have this. I think the real issue here is to have a very good qi. Clinical manifestations of blood stasis, there's sharp pain that is quite fixed in location. The complexion is dull, and you will have tumors or cysts or swelling of the organs, mostly of the liver. So the tongue is purple, or the tongue may not be purple, but the tongue may have purple spots. The pulse is deep, choppy, maybe a little wiry. Then we have heat in the blood. This will usually result from internal heat generated by the disharmony of the liver, usually the liver. Okay. Clinical manifestations, reckless bleeding, which will manifest as hemorrhage, bleeding between cycles. There is restlessness, irritability. So you will expect to have skin problems. The color of the tongue is deep red, and the pulse is rapid because of the heat. So let's talk about the relationship of the qi and blood. Qi is yang, blood is yin. Qi is commander of blood, blood is mother of qi. So blood nourishes the qi. In other words, qi gives life and movement to blood, but the blood nourishes the organs that produce the qi. Qi is yang compared to blood, which is yin. And so we can say that qi and blood are inseparable. What are the four aspects to the blood-qi relationship? The first is qi generates blood. Food qi is the basis for blood. So without food qi, then do not expect to have ample blood supply. Qi moves blood. Qi is considered to be the motive force for blood. When qi moves, blood follows. And if qi stagnates, blood congeals. third aspect is the qi holds blood. It holds blood in the vessels, preventing hemorrhage. For example, if you have spleen qi deficiency, expect petechiae, because the blood will extravasate. It will escape from the blood vessel. Blood nourishes the qi. Qi needs the nourishing qualities of blood, and it provides a dense material, preventing the qi from floating. So if you have a floating qi, that is indicative of a very poor blood supply or blood deficiency.